Hello everyone, I am Dr. Shraddha Sayani. I am a consulting physician and your wellness partner. So today we are going to discuss about women hormone and various other aspects related to it, and primarily mental health which is affected by women hormones. So we have always heard this phrase that I am a woman, what is your superpower? So women is really now dominating in every sector. We are seeing her leading in every domain in the market. We are seeing women in the form of entrepreneurs, mothers, then various other sectors. So why we are discussing this today? That woman is a term which is really very deep, where we have to understand the womanhood, where she has been given with the innate qualities. She has really made the progress, where now she has learned how to balance the roles and responsibilities given to women. She has been given with various kinds of culture, aspirations, dreams, desires. Same time, she knows and values the roles, responsibilities, that is family, social boundaries, then childbirth, mental conditioning. So these are the various factors through which a woman goes through, and these are the innate qualities of every woman. By nature, a woman is compassionate. She knows when to bend, when to rise, when to surrender, where to dominate, and that is the reason, various kind of roles and responsibilities she's handling well. She's coming up with new ideas and leading into the sector. Why we are discussing this today? That woman herself goes through various phases and stages which comparatively they do not have to go. For example, at the time of puberty, when it is the age of 9 years to 10 years, she is now a child is now converted into adulthood. Yeah. So when the at the time of arrival of puberty, then there is a major hormonal shift in the hormones of child. By the time the child settles with her puberty period, that is at the age of 16 to 17, again there is a shift into the hormone, and now this child from puberty is converted into adulthood. So again at the age of 18 to 30, this is the major shift time, and again all the hormones are recycled and replaced, and again it affects the health of a child. Now by the time of 30, 35, a child or a woman understands and settles with a new cycle, new pattern of hormones. She knows the pattern now. She is now adapted and settling with that. Again, there comes a second shift, that is at the age of perimenopause, that is right from the age of 38 to the age of 55. This is the crucial period when a woman is going through various other placements in her life also, like childbirth, then breastfeeding, yeah, then perimenopause. And by the time of all her patterns, she is understanding, settling, again comes the next shift, and that is the menopause. So right from the age of 53, 54, 55 till the age of 58. Now she is again juggling with a new set of hormones, new effects of these hormones on her body, on her mental health, and by the time she feels okay, now I'm retired with all my roles, responsibilities towards family, towards society, towards herself, again she finds herself into a struggle in the phase of menopause. So these are the various factors, these are the various patterns and sudden shifts after every, let's say, 10 years in the life of women. So which comparatively does not happen in cases of men. That is why it is very much challenging for women to understand the cycle, settle with it, and to move on. But what we have seen and what makes us to feel proud about, still we know that we cannot settle and sit back and take it as a setback. We accept this, we learn to adopt this, and we just carry on, we just keep moving on. There are so many in our history. There are women who have created great stories. So I remember a line said, that is, Nastri Ratna Samam Ratna, Nastri Guna Samam Guna. It is only because of this, many people they feel that why there is so much hype about success or achievement of women. So I just want to put this only, that there are so many cycles, there are so many patterns, there are so many milestones that we have to go through. We understand, we overcome, we do not sit and we do not take it as setback, and we decide to go on. So the first milestone is childhood to puberty. Then second milestone, childbirth, right from the puberty till the age of the marriage of this lady. Again, there is a major shift into the hormone. Again, there comes, once the marriage is settled with new roles, responsibilities, there comes a period of childbirth and lactation. So this again is a very new thing for any lady in her life for the first time. Highs of the estrogen and lots of hormonal changes. So at the time of childbirth, at the time of lactation, once this period she understands, unlearns, and settles with that. Again, there is a shift. Now, at the age of 1 year of child, now it is insisted that she should be giving up with the lactation, so that all her hormones will be back to the previous levels. So this is called as postpartum. You all must have heard that postpartum, that is post delivery, many women they feel weakness, tiredness, depression. So this is because of the hormonal change. Now, once she settles, once she understands to learn and settle with postpartum things, again within few years there comes a new set, new challenge, and a new milestone, that is perimenopause. So before menopause, again there are shift into the hormones, and now she has to learn and understand with a new change. So why are we discussing this? Because hormones and mental health, we cannot put them in different boxes. They come together. But since we do not know, we do not understand, we do not know how to handle it, how to manage it. So there are highs and lows into the pattern of women hormone, which influence and regulate the mental health. For example, there are two major hormones, that is estrogen and progesterone. So estrogen, we call it as a good hormone that gives happiness. At the time of this high of estrogen, there is a woman goes into exaggerated of skill sets, good memory, good mood, and happy hormone. We call this as a happy hormone. It is generally increased before menstruation, before the cycle, first half of the periodic cycle, and at the time of her pregnancy. So around first part, it is all good. This is called as high of estrogen, and high, that is good mood, good hormone. But once the period is over, there comes the sudden drop into estrogen and high rise into progesterone. So we call it as a bad hormone because this causes low mood, then depressed feeling, loss of interest into surrounding, loss of appetite, and muscle aches, pains, and various other things. So this typically happens premenstrual time. We call it as a premenstrual syndrome, and typically after delivery. Also, this is seen after menopause. So we are discussing this today because once you know whatever your mental mood, your entire regulation, your mental health is governed by these hormones. You need to foresee that which age you are into, what will be your hormones fluctuations forthcoming, how to handle it, what are the causes and factors which will hamper it, and how to manage it, and how to keep going on. So now we have seen there are lots of changes. We call it as a modern lifestyle disorders, which has made the life more complicated, more challenging for women nowadays. Because now we have become more career oriented, or we prefer more to go into the studies. Earlier there used to be marriages at very early ages. So more than career, it is about giving time. The age of marriage is changed now. So due to various other reasons, social things and various others priorities, now women they are leading into late marriages. Once there is a late marriage, it all leads into the late cycle, that is late peripartum, postpartum, pregnancy, and most of the time I have seen in my OPD while practicing that many women they are facing challenges for natural conceiving, natural pregnancy, having natural pregnancy nowadays. So for that reason, they have to go unfortunately into various artificial practices. For example, artificial hormones, taking supplements, hormonal supplements from outside, or various other practices. So this is hampering the natural flow, natural cycle, natural hormonal pattern of woman body. We have seen there is lack of emotional support in families nowadays. Earlier we used to have big families, lots of people in same house. So due to modernization, there are nuclear families. People are though connected with social media, still there is, as compared to earlier, because in history the women earlier they have created the big things, best histories. But why they were not having hormonal issues? Because the things were too much tuned with the natural process. But now we are facing against the natural process, and still the hormonal pattern is same. So along with the time, as women is progressing, increasing, integrating, the diseases, especially particularly to the reproductive health issues, are also increasing. There is rise into the reproductive health challenges, rise into various type of cancers. You all must be aware about, breast cancers are increasing, cervical cancers are also increasing. So along with the modernization, there are risk factors are also coming up. So what is the solution for this? So today we have picked up this topic only because that there are various factors that is affecting this woman health. That is hormonal imbalances due to various factors, loss of balanced diet, there is no work life or work emotion or life emotion balances, and there is tremendous rise into the stress. Now this stress could be like emotional stress or physical stress. Now whenever we are talking about the stress, as per a study it has been seen that the impact of stress on health of women is more than that of impact on men's health. So as per a study, there is 88% rise into the stress onto the women health as compared to earlier. So before talking about stress, it is equally important to understand what is stress and what are the symptoms of stress, because we do not even understand. Okay, maybe possible I am going through stress. This happens with it is very much normal, natural, and happens with maximum number of women. Because it has been observed that women or anyone in that case, they feel the effect of stress could be only heart diseases, or it could be related to any major disease or major impact on health only. But I want you all to understand pay attention to the small and minute effects as well. For example, headaches. This I have seen in my practice in my OPD very frequently, that one sided headache or frequent headaches or headaches during periods. So women are into too much practice of taking painkillers and just keeping shun about it, and do not understand why these headaches are repeatedly coming up. So headache is one of the most important and crucial sign of anybody going through stress. Then repeated attacks or episodes of stomach upset, or I would say even small symptom like sleep loss or hair fall or loss of appetite, or increased into the appetite. These all are also related to the sign and symptom of stress. So I want you all to put your attention onto the minute symptoms as well, because when it is not put attention at right time, then it leads to the various other bigger diseases like cardiovascular diseases or gastrointestinal diseases or fertility related, and then it affects hormones as well. So this happens together in the life of women, that hormones, they are playing its own role. They are causing weight gain. All the hormones, they are causing mood swings, and plus the stress, that is the stress is affecting hormones. So collectively this is like a vicious cycle. But I want we all to work on this and crack this challenge. So the challenge is understand. Understand, know your body, know your patterns, know your hormones, understand how to balance it, go with the mental conditioning, get educated, understand your entire journey. Also, the important thing, very important thing to keep your hormones at its natural level, that go with the natural flow. I have seen in the practice that many a times, many women in their life, they have a habit of putting artificial hormonal tablets unnecessarily to make their cycle either to prepone or to postpone. But I would recommend and I would request you all not to do that. Just go with the natural flow. Avoid playing with your hormonal patterns. Okay, after that it is again influenced by stress, which we have already talked about. It is again influenced by smoking, alcohol, and sleep loss. So please pay attention to your balanced diet, balanced nutrition, get regular health checks, manage your stress, manage the work life balance, manage about the work emotion balance. Say no to alcohol, say no to smoking. Yeah, add some exercises like 20 to 30 minutes of aerobic exercise daily, and depending upon your work life, your schedule, you can increase this exercises after talking to your doctor. But very important thing, that there are small things which affect at a major level. For example, micronutrients, microvitamins and minerals, they also affect the level of the hormones in women's body. So why not to keep a check on your health regularly. Get your health check done, regular checks about your vitamin levels, your calcium level, your iron supplements. Then checking your thyroid, checking your blood sugar levels, getting yourself scanned to just rule out if there are any chances of PCOD, if there are any chances of fibroids. So doing regular checks at regular interval, meeting to your doctor, talking about yourself, talking about your small health issues, these things as a routine, as a part of routine, will definitely avoid the major hormonal influence and bad impact on your body. Also, do not bottle up yourself. Open up yourself to your friends or family or to your colleague, or to your doctor. So these are the small things I think, but it will cause the major impact, major effect on your body, on your hormone, and it is as easy and as simple as that, that you will keep rocking. So I hope today's session you must have learned something new, you must have enjoyed it, and you will follow the small but very important instructions. In case there is anything you may like to talk or ask about, we are always there to help you. With this, I will sum up for today, and happy to share my experiences. Thank you.